Welcome to all those joining us today. My name is Shelley Hartland, and I'm the Director of Operations and Cultural Transformation for the Legatum Institute. It is my absolute pleasure to welcome you to this webinar to showcase our United States Prosperity Index and preview our county-level analysis for Montana. At the Legatum Institute, we are committed to creating pathways from poverty to prosperity for individuals, communities, and nations. To achieve this, we produce a number of indexes and data sets to help leaders around the world develop practical solutions to deliver greater economic and social well-being for their citizens. Our United States Prosperity Index is just one of those. Thanks to the generosity of the Helmsley Charitable Trust, the Robert Wood Johnson Foundation, and the Walton Family Foundation, we have drawn on our over 13 years of experience measuring prosperity globally to create a holistic and comprehensive analysis of how economic and social well-being are evolving across the 50 states of the Union and Washington, D.C. As part of this program, we have undertaken a detailed county-level analysis for several key states, including Montana. This work will be published next month, but we are absolutely delighted to preview some of our findings with you today. We hope this work will provide an objective means of considering how Montana might emerge more prosperous from its current health, social, and economic challenges. In addition to our own speakers, we are delighted to be joined by two expert panelists today. Kristin Juliar is the Director of Montana Area Health Education Center and the Office of Rural Health at Montana State University. Here, Kristin seeks to enhance access to quality healthcare by improving the supply and distribution of healthcare professionals across Montana. Brenda Solórzano is the Chief Executive at the Headwaters Foundation, a community organization designed to achieve a healthy and thriving Western Montana. Thank you both for joining us, and we look forward to hearing your reflections on the index, as well as the challenges and opportunities for Montana as you see them. There will also be an opportunity for you all to ask the panel questions, so please use the Q&A function to ask these, and ideally include your name, organization, and who your question is directed to. If you have any general comments on anything that's said today, please use the chat function to exchange thoughts and ideas with our attendees and our panelists. Finally, you can find our index data along with our current report and state profiles at our website, www.usprosperity.net. I'm now delighted to welcome our Director of Policy, Dr. Stephen Brien, to provide an introduction to the United States Prosperity Index.
Thank you, Shelley, and good morning to you all, and it's a real privilege and pleasure to be with you today. My role this morning is to outline what do we mean by prosperity and why have we set out to measure it in the United States and indeed in Montana in particular. When we think about prosperity, what we see is that there are a number of issues over and above simple GDP that are very important to people's lived experience and really what we want out of society. So we are seeking to understand what are the drivers of both economic and social well-being, and how do we create an environment where everybody can reach their full potential. I think if we look back over the last few months with respect to the COVID pandemic, or even more recently with some of the social challenges, it's really quite clear that simply focusing on a GDP per capita number, simply focusing on economics is too narrow a view to make sure that we are building a society that everybody is comfortable in and everybody feels that they have their opportunities being presented to them as well as they can. And that's why we have set out, and for the last 13 years around the world, we've been measuring prosperity. We've been seeking to understand, working with experts, to really get a strong underlying theory and strong underlying structure for measurement so that we can assess which countries or which states are doing well and why, and what needs to change, where are the most important areas to work on. And in effect, we have found it boils down to three core ideas. One, are there inclusive societies? Two, are there open economies? And three, are there empowered people? And that, for us, characterizes the three domains of prosperity that we have set out to measure and to define. Now, let's take that one level more detailed and look at what do we mean by those ideas. And as you see on this slide, we've laid out, in effect, the three domains. These are three different colors. Within each domain, a set of pillars, 4 pillars or 3 pillars per domain, and then a series of elements, which are the very discrete policy-focused issues. So let me just walk you through this structure. And everything here ultimately gets measured. So the first domain is inclusive societies, and that looks at institutional structures, which we mean by all the different ways that both formal and informal that people engage with and interact with each other. So we think about safety and security. Is there a level of peace? Are there low levels of crime, violent crime, property crime, etc.? Then we look at personal freedom. We think about underlying freedoms, civil rights, levels of discrimination, degree of social tolerance. What type of agency do people have? Are they free to go around their daily lives, free from interference? Do they feel respected? Are they treated well by everybody else? Governance focuses on how well governed society is in terms of the level of accountability of the government, the integrity of state governments. We think about corruption, democratic accountability, etc. Social capital, the fourth pillar here, looks at the way in which we support and engage each other. So are families strong? Are there bonds of trust between neighbors and strangers? Is there confidence in the public bodies such as the police, the government, the courts, and the media? And that glue is really critical to allowing the rest of the institutions to work. Now, the second domain, open economies, looks at how well-functioning the economic structure is. Is there a good economic engine? And here we look at a business environment, which considers the rules and regulations that determine what it takes to start, to grow, to develop a business. From access to the labor market, access to finance, restrictions such as occupational licensing or other restrictions, some of which are very helpful, some of which can hinder growth. Next, we look at the quality of infrastructure and market access. Is it possible for a business to set itself up, get access to energy, to water, to communications, transport, all the core infrastructure that's needed to trade both within a county, within a state, across borders? And then the final pillar within economics is economic quality, where we look at how productive and competitive the labor force is, how high levels of employment there are, how sound is the fiscal setup within a state, what degree of dynamism, how many new companies are being formed on an ongoing basis. So that captures the economy. The final domain we look at, empowered people, really focuses on the lived experience, people's social well-being. So we think about living conditions, levels of poverty, for example, quality of housing, access to services. Then health, we consider right the way through from behavioral risk factors through to the level of care, to physical health in terms of illness, mental health, increasingly important, and ultimately longevity is a measure of the quality of those lives. Education, we look through all the levels of education from pre-K through to tertiary education, and also the skills of the adults. And finally, natural environment, where we look at levels of emission, exposure to air pollution, the quality of land, soil, etc. What that gives us with those elements, those discrete elements, is in one place on a common basis, pretty well all the things that domestic policy agenda needs to think about. It allows you to compare and contrast how individual counties or states or countries compare across these dimensions, but also start to understand the relationship, say, between the strength of social capital and the level of employment, or the quality of health, or the link between education and employment, or the link between education and freedom. And this ability to compare and contrast different components is really what makes this a very powerful tool. And now, as I said, we've been doing this for 13 years across the world. And when we look at the United States, what we see in our global index is, as would be expected, the economic powerhouse of the world. It ranks 4th on our open economies domain. But as we look more broadly and say, let's take a broader view of prosperity across those other areas I've just been talking about, we see that in aggregate, the United States ranks only 18th. And in particular, when we look at safety and security and health, both ranking in the mid-50s, safety and security because of the high levels of violent crime, And health, because despite some of the best health system in the world, some of the best hospital networks, the most advanced pharmaceutical companies, health in the United States, it doesn't take me to tell you, is quite unevenly distributed. There's a very uneven performance in terms of access and quality. And as a result, we see many more nations across those dimensions I was discussing, putting in better performance on health. So this really triggers to say, well, what is it about the United States? How do we understand the real prosperity of the United States? You know, being a large federal country, we also felt it was probably going to be more useful to think at the next level down in terms of state level performance. What's the difference between Massachusetts and Montana and Mississippi? Because that's really where we start to see the true variation. And that's why we then decided, let's put together the equivalent of our global index for the United States Prosperity Index, which we produced our first edition of last year. And it takes this framework of inclusive societies, open economies, and empowered people, and measures the prosperity of every state, 50 states plus DC. And what that has allowed us to do is really start to find those patterns. And Shaun, in a minute, will talk through some of the more detailed issues with respect to Montana. But what I'd like to do to start with is share a short video with you, which will provide an overview of what we have found across the United States in terms of prosperity.
The Legatum Prosperity Index shows that prior to the COVID-19 pandemic, overall prosperity in the US had been rising for the past decade, although long-standing challenges mean that prosperity was not experienced equally by all Americans. Although the country was ranked high for economic pillars, it was falling behind in living conditions, health, and safety and security. Our U.S. Prosperity Index shows that the country's economic quality had improved as unemployment had fallen after the financial crisis. This meant it was in a strong position before the virus hit, but of course that strength is now at risk. Improvements in education and living conditions had also been significant in driving the growth and prosperity over the past 10 years. Although education had been improving, school closures as a result of lockdown measures put the progress made on educational outcomes at risk. More positively, one area of living conditions that had improved significantly over the last decade was connectedness, with access to broadband rising in both rural and urban areas, enabling greater connectivity during lockdown. Health in America had improved over the first 8 years of the past decade, so the country was in a good position to deal with the impact of the pandemic. However, the mental health of Americans had already been declining even before the coronavirus crisis. There had been large increases in drug overdose deaths, rates of suicide, and levels of serious mental illness across all regions, with 48 states seeing mental health decline over the past decade. Deteriorating social capital was also impeding further prosperity. While personal and family relationships had strengthened, social networks, institutional trust, and civic and social participation had all deteriorated. The fact that only 11 states had seen an improvement in social capital since 2009 is a real concern, given strong communities are the cornerstones of society, and the decline in other states is indicative of societies that were already coming apart rather than drawing together. Despite these national challenges, the U.S. Prosperity Index shows that, before 2020, prosperity had improved in 47 of the 50 states, plus Washington, D.C., providing a strong foundation on which to build a recovery as the country emerges from these challenging times. But while all but 4 states had seen prosperity improve, no single state has yet succeeded in fostering a high degree of both economic and social well-being for its entire population. Other than top-ranked Massachusetts, no state ranked above 20th in all 11 pillars of prosperity. Now more than ever, it is vital that all states seize the opportunities to learn from each other to increase their prosperity and share their experiences with one another to help them improve.
Thank you for that helpful explanation, Stephen. I now invite Shaun Flanagan, the Director of our Centre for Metrics, to unpack the index in more detail.
Thanks very much, Shelley, and good afternoon and good morning to everybody. I'm very pleased to be able to talk you through some of the findings today for Montana. What you've seen there through the video is the sort of macro level findings that we've found through the index. And as I say, what I'd like to talk you through now is just some of the findings for specifically Montana. Before I do that, Stephen alluded to the index that we've constructed and walked you through the taxonomy. Whilst we're experts in measuring prosperity, we were very much aware that how that translates into the US. We wanted to make sure we absolutely got this right. So we sought the expertise of around 40 experts across the US, experts in health and education, across the 11 pillars, who not only helped us create the taxonomy, but also helped us select the relevant data sets that we should use in order to best proxy those 48 policy focused elements. So we've ended up with an index that's got over 200 indicators, 216 indicators. So it's very comprehensive, and we'd just like to very much thank those experts who were so helpful in designing the index, and I think some of them may be on the webinar today. Before I dive into the detail for Montana, I just wanted to have a quick look about how prosperity translates across the 50 states of the Union and DC. The ranking table on the right will be familiar from the video, but this map on the left just shows how prosperity is currently positioned ahead of going into the pandemic. And obviously you'd see very much there a North-South divide. 8 of the weakest performing states are located in the South. And whilst the majority of top performing states are in the Northeast, actually some of the other states across the US are also top performers, so the likes of Colorado, Utah, Minnesota, and Washington State. But what does the index tell us about Montana? So this is the ranking table. There you hopefully can see Montana highlighted. It ranks 35th overall when you combine these 11 pillars of prosperity, and its performance is varied across those pillars. So its best performing pillar is around social capital, and I'll talk a little bit more about that in a moment. But when we look across into the open economies domain, we see that on business environment and market access and infrastructure, it ranks 44th and 48th. How has that prosperity changed over the past decade? One of the things of the index is that it does have historical data, so you can see whether things are strengthening or whether things are weakening across the different elements and pillars. What we see here for Montana is that its prosperity has improved over the past decade, perhaps a little bit behind the sort of overall average for the US, but it's broadly tracked what's happened for the state, for the nation as a whole. And on the right-hand side, you'll see here what has driven that improvement in prosperity. So on the open economies domain, we see that business environment has improved, market access and infrastructure is broadly the same, economic quality has deteriorated, as has safety and security, and social capital alongside many other states, as was discussed in the video. We see that there's been a fairly large improvement in living conditions, with health and natural environment also improving, but education seeing a slight deterioration. So what I'd like to do now is just use the index to highlight some areas of strength for Montana, and then to discuss an area of weakness. And it's very much along the idea of sharing and collaborating. So looking at a particular strength of Montana, where could another state that is perhaps performing more weakly on that particular aspect to learn and benefit from Montana, and vice versa? Where is Montana, where is there a weakness where another state could perhaps share some of its learnings, or it could learn from another state? So if we take social capital, so this is the pillar of social capital. On the left-hand side there, you have the different elements, the 4 elements that make up social capital. It's personal and family relationships, social networks, institutional trust, and civic and social participation. Now, you'll notice that on institutional trust, that's the extent to which residents have confidence in federal government, trust in corporations, but also trust in the media. You'll see that that ranks 47th, so that is quite low, and it is an area perhaps of concern. But I want to look at civic and social participation today, which you'll see that the state of Montana overall ranks 2nd. And then if we look at the actual indicators that best proxy that we use in the index to measure that, it's made up of these following indicators. So you'll see these are around the extent of volunteering, but also the extent of how active people are in their neighborhood, how much they help the community, and the sort of participation around membership, religious, non-religious organizations, and the extent to which people participate. So we see across here that the state actually ranks pretty highly on a number of these indicators. Its volunteering intensity has decreased over the past decade. So it was 12th in the rankings, it's now 42nd, but nonetheless, it still performs well across a number of these indicators. So if we were to look at another state where perhaps the strength is not there, looking at California, again, overall, California ranks 44th for social capital. And on this particular element, civic and social participation, it ranks 40th. So if we have a look at the individual indicators and how they compare, we look across at the top row there on volunteering, extent to people who are engaged in the neighborhood or active in the community. And on the bottom, we have a row of the indicators around participation, membership organizations. We see that Montana performs better on nearly all of these indicators. And the question really, I suppose, is what is it that Montana is doing around that's creating sort of stronger social ties amongst people that actually California might benefit from? What initiatives or strategies are at place within the state that California could benefit from or learn from to help improve its social capital? So let's consider an area where perhaps Montana doesn't perform quite so well. And here we're looking at the different elements of health Stephen talked through earlier. And in particular, I just want to look at mental health. You'll see there that overall mental health in Montana, it ranks 45th out of 51. And like a number of states, has seen a deterioration over the past decade. So it's fallen 2 places in the rankings. Again, if we look at the indicators that underpin mental health, we have suicide rate, drug overdose death rate, sorry, serious mental illness, the disability weighted prevalence from mental illness, and a self-reported measure. We believe these self-reported measures are important, as well as objective measures. How people think or feel about things is equally as important. And so these indicators collectively measure mental health. And we see in particular on suicide and disability weighted prevalence from mental illness that Montana performs, has a weak performance across these. And this obviously is a concern at the current time with the COVID-19 pandemic. And actually, as people are concerned about their jobs, will they have a job to go back to? But also just the general anxiety levels that surround a pandemic such as this is obviously creates a lot of anxiety and fear within people. And that therefore will potentially exacerbate the extent of sort of the mental health issue within the state and also across other states. But given that it's already starting from a relatively weak position, this is obviously an area of concern for Montana. So let's have a look at another state perhaps where performs a stronger performance on mental health. So if we look across at Nebraska, we see that overall Nebraska ranks 8th for health. And then underneath you see the performance across the different elements. And highlighted with the red arrow is its performance on mental health. So overall Nebraska ranks 9th for mental health compared to Montana's 45th. So again, if we compare and contrast across the indicators, we see at the top there the 2 related to sort of rates of death, of suicide and drug overdose. And then on the bottom, the self-reported mental health, serious mental illness and disability weighted prevalence. So on all these indicators, we see that Montana has a weaker performance than Nebraska. And again, this is an area which would highlight potentially initiatives or services or things that perhaps Nebraska has that Montana could also benefit from. So are there things that Nebraska's doing that could be shared at best practice, for example, that could be shared with Montana to help? Now, I know this is an area that's well known within Montana, but this just sort of helps use the index to highlight other areas, other states where they are performing more strongly and perhaps an area that could learn and collaborate from. So that kind of just concludes what I wanted to talk about really on the state level analysis. That hopefully just gives you a bit of a sense of how the state level index can be used to interrogate and identify strengths and weaknesses of states. And as Shelley has mentioned on our website, there is a profile for each of the 50 states and DC, which provides full transparency of all the pillar, element and indicator scores. So you can really drill down and see how performance is playing out across each of those areas. So I encourage you to go and have a look and download them. They're all open source, so freely available. I wanted to conclude by just talking a little bit about our county analysis, which we've been doing over the past year. So we have done this for 8 selected states. We would have absolutely loved to have done this for all 3,000 plus counties in the US, but obviously it's a huge amount of work. So we've selected 8 states, and they've been selected on the basis of geographical and demographic coverage, but also where they rank in the state level index. So some at the top, some in the middle, some towards the bottom. And in constructing the index, county level index, what we've tried to do is mirror the state level index as closely as possible. So it has the same number of indicators, 215. And we've been able to identify 132 of those that have county variation. So that's either actually at county level, or it might be at metropolitan statistical area level. There are 83 indicators where we use a state value. And that's for 2 reasons. One is because for some indicators, each county would have the same value as a state. So it could be around certain laws, or it could be around state occupational licensing, equally relevant to all counties within a state. But there are some where we would have liked to get county variation, but it's just not available. So we have used the state average as a proxy, which allows us to compare and contrast across states for those counties. So what you see here is how prosperity translates across those 829 counties, grouped into quintiles. And what will strike you fairly readily, I think, is that some states have a high degree of homogeneity. They're quite homogeneous in how prosperity translates across the counties. So particularly Iowa and Colorado, but also New York, whereas other states have a high degree of variation in how prosperity translates across the states. So yeah, when you look at California, and to some extent Montana, but also Texas, we see that there is a difference on the states, and I'll come on to that a little bit more later. But what we generally see is that those urban areas have higher levels of prosperity of rural areas, but that is not universally the case. There are some rural areas that outperform urban areas, and we explore this in more detail in our report, which is going to be published next month on our website. So please look out for that. But let's just have a little look at Montana. So this is how prosperity translates across the different counties of Montana. On the left, you have the strongest performing counties, and then on the right, the weakest performing counties. So there are 5 counties that appear in the top 20% of the county index in terms of their performance. And there are 3 that appear in the bottom 20%, and the remainder majority are within the second quintile. But how does that translate into the 3 different domains? So what we see here on the left-hand side is in the map for inclusive societies, and you'll perhaps see there that there is, it's fairly homogeneous on how that is shared across the different counties of the state. And all counties perform particularly well in this. They all rank in the first or second quartile, although as the state as a whole has seen a deterioration in inclusive societies over the past decade, and it's fallen 6 places in the state rankings. When you look at the open economies domain, you see a different picture emerging, almost to some extent the sort of reverse of what you see in inclusive societies. So what drives this really is sort of evident when we look at the state level. There is a fairly weak internet capability across the state. We see that. So whilst 80% of residents across the state have high-speed internet access, only 5% have ultra-fast internet access. Also find, compared to other states, that it's not particularly well connected physically. There are fewer airports and also fewer available roads across the state. However, you will notice there are 2 counties that are in green, so that doesn't equally translate to every single county. And these 2 counties buck the trend and are in the top 40% for open economies. So Gallatin and Richland, and that's due to better internet access, and they're also closer to airports. And then on the right there, you have how the empowered people score translates across the counties as well. I just wanted to conclude to talk a little bit about the county architects that we've been doing. So this is looking at, rather than just analysing how counties perform within a particular state, what we've done, we've seen how counties cluster together across the 8 states. And we find a number of different archetypes emerging, where actually we see counties have similar characteristics to counties in other states rather than necessarily in their own state. So we looked at this in two different lenses. We looked at archetypes of urban prosperity, and we also looked at archetypes of rural prosperity. And what you see here on the left is the bar chart that shows there's three different clusters that emerge when we look at the archetypes of rural prosperity. We have the northern prairie, southern plains, and the southeastern coastal plains. And the northern prairie is made up of these counties on the right, which you'll probably recognize as those being in Montana. So 35 counties within Montana. And overall, their performance is broadly similar to the 8-state average when we look at but a stronger performance than those in the southern plains and the southeastern coastal plains. When we look at their performance across the pillars for this particular cluster, the northern prairie, we see actually on the inclusive societies domain, they perform very well. They actually outperform the 8-state average on all of these four pillars. But when we look at the economic aspects, the open economies, we see that it underperforms against on those three pillars. And then on the empowered people, it's a bit more of a mixed comparison in terms of performing slightly stronger or slightly weaker. But what does that mean in terms of areas of strength and areas for improvement? So what we see, particularly for the northern prairie, is that the areas of strength is there are strong social capital, low levels of crime, generally good physical health. There's access, obviously, to plenty of outdoor activities, clean air. But on the areas for improvement, the first two are around the economy, financing ecosystems, so strengthening that, but also improving the communications and transport infrastructure, as I was talking about a little bit earlier, the mental health, and also improving the access and availability of fresh water resources. So what I've talked about today is hopefully just giving you a bit of a flavour of what's available and what can be done through the state level index, but also some early findings from the county level index. So I've demonstrated how these indexes can be used to identify strengths and weaknesses for Montana and the counties within it. So our hope, really, our ambition, if you like, is that state and county leaders and other policymakers will use these indexes to create data-driven policies that will improve the lives of all residents within Montana. So with that, I'd like to thank you very much for listening, and I will hand back to Shelley.
Thanks very much, Shaun. Thank you all for your comments on the chat function. There's a lot coming through there. Quite a few people have asked about whether we'll be releasing a recording of this presentation. Yes, we will. It will be available on our website, li.com, in the coming days. So please do keep an eye out for it. And please do send through any questions you have for the speakers you've heard from and the speakers that are to come on the Q&A function on Zoom. As Shaun outlined, there are clearly a number of challenges ahead, especially due to the health and economic consequences of the COVID pandemic, as well as the wider social challenges that have resurfaced recently. However, there are also huge opportunities for Montana to emerge more prosperous from this. To discuss some of those challenges and opportunities, I'll now turn to our expert panelists to offer their thoughts. Kristin, if I can come firstly to you. As Director of the Montana Office of Rural Health, you are particularly focused on the health challenges facing rural communities. We are currently living through a major health crisis, and the index shows that health is on a downward trend in Montana, especially mental health, as Shaun just referred to. What do you think are the particular challenges across the state, and how can Montana emerge stronger from the coronavirus pandemic?
Thanks, Shelley. Yeah, there's certainly a lot to digest here and a lot of things to really ponder as we go forward. So I thought I would focus on a couple areas, mental health and the broadband issue. Could talk about quite a few of the others as well. But our office, we do community health needs assessments with the critical access hospitals, which are the small rural hospitals of 25 beds or less, and work with also the public health organizations on their looking at their assessments. And mental health is consistently in the top 3 of the issues that are identified by community members throughout the state and every community. Been a very big issue for Montana with our very high suicide rate. I do think this is an area where in COVID, and one area has, I think, really brought to attention that almost everyone can talk about a mental health issue related to COVID, either in their own life or in their family's life with the isolation, and has really opened up, I think, some conversations that people weren't having. At the same time, there's been a tremendous amount of work that's been going on in the state in the last couple years around taking a more integrated approach to mental health and behavioral health by integrating it into primary care and really creating a different look at how we get services out there. I noticed Bighorn County was one of the counties that was spotlighted as having some real challenges in the indicators. And Bighorn County has been like a leader in really, Dr. Mark there at the Bighorn Clinic in creating an integrated approach to behavioral health and really making their clinic totally a behavioral health clinic, although they are a primary care provider, and really looking at everybody who walks in the door as someone who probably brings in some sort of behavioral health issue with them related to chronic care or their life situation or just what's happening at any given time. The Montana Healthcare Foundation has been putting in a lot of resources into helping primary care organizations, which are primary or setting for healthcare across rural Montana, to become much better at providing behavioral health services. I think there's a huge partnership looking at the other social determinants of health and how that impacts mental health. And the social determinants of health that we talk about, transportation, housing, jobs, really translates into the things you're talking about with the prosperity index. So I think that's an area that our state has really started to grapple with in a very concrete way over the last few years. It'll be interesting to see if the changes in those indicators as a result of the work that's been underway right now. And another area, I think we have certainly all woken up in COVID to the importance of broadband and having good internet access. I know a couple of my coworkers who work from home in very rural parts of Montana have quite a bit of trouble in getting on the internet, being able to show their video on Zoom meetings. That's pretty common throughout Montana. And so we really need to continue to work on expanding broadband access throughout the state in a very equitable way to our rural areas and the tribal communities. And COVID has also had a big impact for rural healthcare providers because of regulatory changes that now allow our rural providers to be the originators of telehealth services, and really recognizing that if you're an isolated rural elderly person, a telephone might be your best access for telehealth services. And those changes right now are temporary. We really need to make sure that we have a regulatory environment going forward that supports telehealth in rural areas in ways that make sense for us, but that we also have the broadband access and the cellular coverage that makes that really possible for our rural areas. I just think the partnerships piece, that social capital, is so central to how we operate in Montana. Talk about ourselves as being a small town with a very long main street. Everybody is kind of on a first name basis. And so when things come up, there really is an opportunity to pivot quickly in our state. Examples like Bozeman Health reaching out to Sims, a fishing manufacturing company, to make heavy duty gowns for the hospital workers. Those kinds of things can happen real quickly in our state, and I think that's what we really need to build on.
Brilliant. Thank you so much for your thoughts, Kristin. We will now move on to Brenda, who's our other sort of panelist for today. So Brenda, you have a wealth of experience of working with different stakeholder groups in Montana, and prior to that in California. What are your thoughts on the findings presented today? And how do you think the index might be used to encourage more effective policy interventions so that Montana and the United States as a whole can emerge stronger from this moment in history?
Hello, everyone. Thanks, Shelley, for that question. I'll start off by saying that I wish this index had been around when I first came to Montana 3 years ago, because it has all the information that I tried to collect a variety of different ways. Some of the sources that Kristin already mentioned, as well as just one-on-one conversations over the entire region of Western Montana. And the good thing is that it's consistent with what we heard and saw in those other areas. So there isn't anything that I would say is terribly striking or surprising based on anecdotal information, conversations, and existing data sets. But a couple of things that make this really relevant and different. One is the independence of the data. The data comes from public sources. The ability to look at this data over time, it's 10 years worth of data, and the ability to see where things are going directionally. Where are there areas that Montana is not doing as well, and where are there areas where Montana is doing better? And asking the questions of why is that and what we can do that is different. So that ability to see that over time, my understanding is that this information will be updated on a regular basis. And so the ability to not only look at it at this moment, but also over the next period of time as we begin to try different things to address the things that are highlighted by the index are really important. So that comprehensive, long-term, independent data, I think, creates a real valuable source that confirms, I think, what a lot of us who live and work in Montana already know. I think that a resource like this creates an opportunity for us to have a shared roadmap of what are the highest level priority areas that we as Montanans need to be thinking about and addressing and coalescing around. It also creates an opportunity to have an apolitical conversation that's rooted in just data and not an issue that can be swung one way or the other. And when policymakers and those of us who work with policymakers take a data-driven approach, we know that we have the capability of producing better policy outcomes as a result. I think the other thing that's really interesting is looking at this information from a local perspective. I think having come from California, I knew that what I saw in California was not going to be relevant to what I see in Montana. And what I see in Missoula is very different than what I see in Lake County. And so the opportunity to look at these informations by specific regions allows us to look at what is happening in those local communities and therefore have more locally driven solutions to those areas that we know are problematic. I think from Headwaters' perspective, we are a health conversion foundation, and we came into this with an understanding that health is comprised of a lot of different elements. And many of those elements are captured by the various pillars and indicators that are being collected by the index. So things related to the market and economy, housing, food, as well as the behavioral health and physical health components. And when we take a broader approach to looking at what are the challenges that exist in Montana, and we look at things holistically, we're able to more effectively begin to identify potential solutions for that. I think a couple of the areas that stand out for me, in addition to what Kristin already shared, are the fact that we are ranked relatively well in the social capital components of the index, but it's falling. And I think that's a question to ask ourselves. Why is that moving in a different direction? I think that one of the strengths that we do have is that we are this small state where everybody knows each other. And so that ability to work together, to know each other, to help each other is a strong piece that really stands out in this index, and something that we should really step into. And I think model, because when I look at the difference between what happens in states like California and Montana, that ability to work together and know each other, I think makes a big difference in terms of being able to come together as a society to address the social determinants of health, issues that affect people. I also think that in the area of empowering people, for Montana, I think there's some questions to be asking around why aren't we scoring as well in those particular areas. And I think given the social unrest that has been happening in this country, how is that playing out in Montana, specifically as it relates to the indigenous communities that that live within the boundaries of the state of Montana. I think another area that is worth highlighting from a Headwaters perspective is the pre-K issue, and knowing that we don't rank very well on that. In fact, I think we're 49th according to the index in terms of pre-K. And that's an issue that has come up consistently in Montana, and something that we at Headwaters are hoping we can contribute to a solution so that we rank a little bit better in that particular area. I think one of the things that'll be interesting for you all who work on the index to think about is a race component. If you could break this down by race to look at how that would look like in different states, and also across income levels, and trying to see if either of those two things begin to play out in what the data would show if you broke it up by those particular areas. I'm just really excited that this is available. I'm hoping that all of us who are in Montana, who are listening to this conversation, can share this with our colleagues, can work with our policymakers, and can collectively begin to build a roadmap that helps us address those areas where we need improvement, and also learn from those areas where we have great strength in Montana.
Great, and thank you so much, Brenda. That was so insightful and helpful. And I feel like you've asked a few questions already, so it may be that we take your questions as we enter into our sort of question and answer time. So again, please do keep sending through any questions that you have for any of our panelists. Again, just put your name, organization, and who the question's for, if you can, in the Q&A. But maybe if we just start with the question that you were just asking, actually, Brenda, and if I could direct that to you, Stephen, if that's okay. We haven't heard from you for a little bit. So Brenda was asking, I think, a really insightful question around race. Obviously, that's a pretty big topic at the moment, and our index. So would you be happy to sort of speak into that a bit more?
Sure. Thank you, Shelley. Thank you, Brenda, for raising this very important and indeed very topical issue. Let me start with how the index sort of views the world, and then bring in the race and other issues. We have typically taken a sort of geographical starting point, and at one level, if you look at the index and look at state and then county level, as you get down to lower levels of granularity, obviously the sort of racial mix changes. So the first order answer is there is already a component of race in the index. I think when the chat function already identified, one can see the Indian reservations coming up, the counties with the Indian reservations. But that's sort of a by proxy approach. Where we have data, we do seek to capture it. And in the global index, when maybe race is less the dimension within country between countries, but say gender differences, where we can capture information about important subsegments of communities, we will put it in. So, for example, property rights for women, violence against women, employment levels for women are all things we capture in the global index. Unfortunately, at the US level, we have found that getting systematically consistent race-based data on issues that we are capturing in the index has been actually very difficult. And we have not been able to find that much. And so much so that when it came to social tolerance, we actually did our own work and generated our own indicators. So one of the indicators we have is the prevalence of ethnic slurs as a way of indicating a degree of social, racial tolerance. So we have viewed that as a best proxy. If the Census Bureau, if other state organizations publish data disaggregated on a racial breakdown, we would gladly incorporate as much of that as we could, and also look at other dimensions of society where there are weaknesses and disparities, because it's really for us about making sure that prosperity is afforded to everybody, and whatever important dimensions there are for breaking that down, whether it be sort of a male-female divide, a race divide, an age divide, we would happily capture anything we could find that's pertinent to really get under the skin of these issues. So it's not for want of trying, but it's more actually that, and we would encourage all the public bodies to disclose more of their data based on those breakdowns so that deeper sociological studies could be done.
Great. Thank you so much, Stephen. Not an easy one to get us started, but a really helpful explanation. I'm just going to go to the questions that you've been sending in. A question from Gary Gannon, but Shaun, if I could direct this one to you. What is the role in qualitative information versus quantitative in the Prosperity Index? And do you use qualitative information for specific geographies to weigh the variables or indicators?
Yeah, that's a very good question. I mean, I think the index is entirely quantitative in its measurement. So it uses quantitative data sets, which are all from credible sources, as I said earlier, advised by our 40 US experts. And so we've curated all of those together into this overall index, produce almost like I think Brenda was saying, a roadmap for states and counties to be able to see how to perform. But it does show you the what and how things have changed, but it won't tell you why things have changed. And that's why it's very important to supplement this with local information, with local knowledge. So, where Brenda was talking about, the sort of relevance of California, for example, that is supremely important. And people within the state will know which other states are similar, have similar issues, and perhaps therefore are most appropriate to compare with. So I think this index is most powerful when it is used with qualitative information, local information, local knowledge, to supplement what the index is showing. But the index almost provides the foundation, the starting point, which then you weave in this other information to help provide a way forward.
Great, thank you so much, Shaun. Speaking of local knowledge, I might come to both of our expert panelists now, Kristin and Brenda. One of the questions just asked was from a Hugo Irving, and he said, my question to the panelists is, what initiatives do they think have been most successful in improving prosperity in Montana that other states could learn from? So Kristin, could I just come to you first on that?
Well, there's quite a few. One that comes to mind is we've been working with a group on building healthy communities. And we were supposed to put on a conference in April that we were not able to do. But the real focus has been on cross-sector engagement. So getting the transportation, commerce, economic development, community development, infrastructure, along with healthcare, higher education, secondary, early childhood, as Headwaters is so focused on, to really work together on solutions, not just in little silos that if we do this, that might help, and if we do that, that might help, but how do we really bring it all together and work collaboratively to make some changes. And there's some great examples going on at the community level. I know Sydney, Montana, for example, they've been doing this kind of work for a long time and have made some really important community efforts that bring all the sectors together. And they're a good example, I think, of how to do some of this work.
Great, and thank you so much for your thoughts on that, Kristin. Brenda, could I come to you with the same question?
Yeah, I think that there are a lot of really locally led efforts that maybe don't get highlighted across the state, where communities are coming together to try to address a variety of the different indicators and the pillars in the index. So one are some of the efforts that the Montana Healthcare Foundation has been seeding around creating a connection between homelessness and healthcare, and for communities to figure out creative efforts on how to deal with that particular issue. I think another one that stands out is some of the work that the universities have been doing in trying to create ways for healthcare to be accessed in the more rural communities via some of the use of technology. And then another one that I think we've been really excited to be part of at Headwaters is the 0 to 5 initiative, where it's local efforts bringing together multi-sector groups at the local level to inform strategies for how to address this issue where we score very poorly on. And while the initiative itself is relatively new, very early indications are showing that people are coming together, being innovative, coming up with locally based solutions to address the issues that are driven by the local situation. So I think those are some examples where people coming together, putting community at the center, are really the kinds of things that make a difference. And I think, again, this gets connected to that notion of Montana's strength, that we are a small state where everybody knows each other and everybody can pick up the phone and have conversations. And I think the more that we step heavily into that strength, the more that we can address some of the areas where we're not doing so great. And I think, again, be a model for other places in the United States where people aren't coming together and having conversations and collaborating to figure out how to address these complex social issues.
Great, and thank you so much for your thoughts on that, Brenda. And it's so nice to hear such positive things about Montana as well. We've got 4 minutes to the hour. We've got time for one more question that's just come through, and it addresses the idea of actually sort of smaller states and state versus national. Stephen, can I direct this final question to you? The question that came through is, doesn't the fact that the top performing states in the USPI are generally the small ones, and that in your global index it's generally the smaller countries that perform better, show that your index is inherently biased against big rural areas?
That's a question we looked at actually on a global index, because people looking at the top will notice that. However, when you look at the bottom of the index, there's also a lot of small states and nations. And really what you're seeing there is that smaller groups and societies will tend to have greater variation. So you'll get more of the good and more of the bad, whereas larger societies, larger communities, larger nations, will tend to be a little bit more average. Because if you break a large one up, they'll have good and bad, and they'll go to the edges. So we did quite a big amount of statistical analysis on the global index with a larger number of countries, and we found that there was minimal size bias in prosperity. So I think there's a little bit of an optical illusion going on. There may be a separate issue in the United States vis-a-vis the size of the, if you think about the sort of, 13, colonies come initial states, all tend to be geographically smaller. And because of their longer history and better established commercial connections, they tend to be more prosperous. But I would actually say that's probably a function of history rather than actual size. But that may be what's bringing a little bias in on the US side. But globally, there's no size bias whatsoever.
Great. Thank you so much, Stephen. Thank you to all of you on the webinar who submitted questions, comments. Thank you to our speakers and our panelists for their thoughts. I really hope today's discussion will encourage wider and continued engagement across the United States, and especially here in Montana. As a reminder, you can find out more information, including all the raw data sets, at our website, www.usprosperity.net, which is currently shown on the screen. Today's event is also just one in a series of webinars we are hosting over the coming weeks. Further details will be posted in the chat function and are also on the screen, and we would be delighted if you joined us for any or all of these events that we're hosting. At the Legatum Institute, we create indexes, publish reports, and host events to help leaders, policymakers, and influencers at every level identify the practical solutions that will deliver real and lasting prosperity. Please make full use of our index and its related resources to help set agendas for growth and development and create roadmaps to improve institutional, economic, and social well-being for the whole of Montana and for all Americans. Thank you so much for giving up your time and joining us today. And a special thank you again to our expert panelists for generously giving up their time and for their insightful local perspectives. I hope you have a wonderful rest of the day. Thank you.